So welcome everyone. So this is our Mind Your Brain Health presentation. It's January, so it's Alzheimer's Awareness Month. So we are very lucky to have a whole month of activities about Alzheimer's disease. And the idea is that the Dementia Society of Ottawa and Renfrew County, through the Alzheimer's Awareness Month, is raising awareness, also addressing stigma, as well as showing support for those living and affected by dementia and their communities. So my name is Herman Chique Alfonso, and I'm the Education Coordinator for the Dementia Society of Ottawa and Renfrew County. So I'll be your speaker today. And so start with, have to say that, as we said, our presentation is called Mind Your Brain Health. So this is our Alzheimer's Awareness Month edition. So we are in the middle of, we're starting our second week already. And this week is week number 2. So 2023, new year, fresh start. So during this week, so the goal is to highlight the importance of risk reduction for dementia and Alzheimer's disease, so we can start reducing the risk of developing dementia. That could be even by 40% if you adopt a brain healthy lifestyle. So small changes definitely can make a big impact. So we encourage everyone to take note, follow these advices and little tips to help our brain health, to support also our brain to make a better work, a better job, and take care of ourselves, especially during these times. So, and also we can fend off and prevent dementia. So our second week starts with this. So next week, we're going to talk about risk factors. I will mention some of the activities, the upcoming activities for the month. So stay tuned for more. And thank you for joining us. So let's start talking about our presentation today. So why we talk about brain health today, and I just want you to reflect, also think about what you've done for your brain. Our brain is part of our life. It's pretty much ourself, right? So it's about movement, sensation, thoughts, memories, feeling, behaviors, everything it's in our brain. So what we do to take care of our brain every day. So have you thought about it, or have you thought the importance of our brain? So I start with this question because the brain does an important and complex work, and sometimes we call it the headquarters of the CEO of the body, right? So the brain does such an important work. Is 2% of person's body weight, but uses 20% of the oxygen we breathe. So it's so important to take care of our brain, and also we need to care for our brain as the rest of the body, of course. And we know that there's a lot of evidence these days that we can do things to for the health of our brain. We can do things and also to prevent Alzheimer's disease and other type of dementia. And we know, for example, in 2019, the World Health Organization published a few articles and evidence about brain healthy choices. And just in 2020, there was a important publication about dementia prevention by the Lancet Commission on Dementia Prevention, Intervention, and Care, led by Dr. Livingstone, that talk about different risk factors that could be addressed to prevent Alzheimer's disease and other type of dementia through life, right? So in different stages of life. So these 12 risk modifier risk factors might prevent or delay up to 40% of dementia. So it's so important to know this fact, and also that we know about risk factors already. Talking about those risk factors, this is actually an infographic taken from the Alzheimer's Disease International. Talks about those 12 risk factors in life that we can address, and we can change our brain health habits. For example, I will mention the 12. The first one is physical inactivity. Second one is smoking. Third one is excessive alcohol consumption. The fourth is air pollution. The fifth is head injury, and the sixth is infrequent social contact. Seven is less education. Number 8 is obesity. 9 is hypertension. Number 10 is diabetes, and 11 is depression, and the 12 is hearing impairment. So you can see that these 12 dementia risk factors has been identified by the Lancet Commission of Dementia Prevention and Care. So this is sort of like an informative way of showing you how important it is to address these 12 risk factors. So let's dive into our topic today. So now you know the risk factor, a little bit about the evidence. I want also to know, so today we're talking mainly about 3 main things, right? So I'm going to be talking about brain healthy choices. So those choices, brain healthy lifestyle that you can do every day so you can improve your brain health. So second, we're going to talk about aging brain, what happens when we age, but also we're going to mention some words about dementia. So this is not a dementia full course. If you want to learn more about dementia, I highly recommend you to follow all the education that we provide through the year. But today we're going to talk a little bit about dementia and type of dementia. So at the end, we're going to have a Q&A. I know it's also the Q&A has been, it's available for you to post your questions. The chat also is available. And in addition, this presentation has closed captions, so you can use it or activate it anytime if you need them. So let's start with our brain healthy choices. So number 1, let's see. Yes, so brain healthy choices. So number 1, I'm going to show you 8 brain healthy choices. They are evidence-based, also scientifically proven. So these are ways that you can use to improve your brain health and also prevent Alzheimer's disease and other type of dementia. So let's start with so let's start talking about them first. So number 1 is care for your heart. Number 2 is be active. Number 3, eat healthy. Number 4, be social. Number 5, challenge your brain. Number 6, protect your head. And number 7, sleep well. And finally, but not least important, care for your mental health. And actually, through this Alzheimer's Awareness Month, we also have a presentation next week about mental health and women's brain health. So I'm going to be talking at the end, so you can join and also register. So these are the 8 brain healthy choices. So I'm introducing you to ways to improve your brain health and also prevent Alzheimer's disease and dementia. So let's start with number 1, care for your heart. So care for your heart. What is good for the heart is good for the brain. So a good, what we do when we take care of our heart, so the heart has an important function. And when the heart and the blood vessels are healthy, they do a better job supplying the brain with oxygen, nutrients, and blood. So when we have a blood flow problem, for example, to the brain, so this can cause vascular dementia, for example, and could be, and also if you have someone has a stroke, if we don't take care of our blood vessels, someone could have a stroke and also might have an increase the risk of for dementia. So it's so important to take care of our heart. And we had last year we had some webinars about heart, healthy hearts, how we can improve our health, and also how we can improve our brain health through taking care of our heart. We had a women's brain health last year webinar. So I'm going to also echo those comments. So have a regular health checks, know your numbers, blood pressure, cholesterol levels, blood sugar, weight, and also important to quit smoking and limit alcohol. So those are some advices so you can start caring for your heart. So what is good for the heart is good for the brain. So this is number 1, care for your heart. Number 2, be active. So these days there's a lot of more research about the importance of having an active lifestyle, especially doing physical activity. You can aim at least 30 minutes most of the days to prevent dementia. And also the Heart and Stroke, the Heart American Association also recommends 150 minutes per week. So at least 150 minutes per week, 30 minutes at least a day of physical activity, move more, sit less. You can move to your abilities. You don't have to run a marathon or join the Olympics. You just have to, move more. Also, there's so many, these days, there are so many smartwatches or applications that allows you to, follow your steps. So try to, track your step, track the movement. So it's so important to have a physical activity every day. And this is not all, it has many health benefits. For example, so it's good for the heart. It reduces risk of having a fall, and also it's good for bone health, for example. So I recommend everybody to be active. Is scientifically also research proven that having a life physical activity every day could be beneficial for the brain, and also could help you to also to improve your brain health and prevent dementia. So number 2, be active. Number 3, eat healthy. So I'm not a dietitian. However, I can recommend to just follow the Canada Food Guide, as simple as that. So following the Canada Food Guide will tell us that this should be the plate that you have every meal. So it should be at least 50% of vegetables and fruits, especially greens, and also berries. For example, those are have some benefits for the brain. So also, if you have to decide for proteins, so a quarter should be protein, especially fish and white meat compared to red meat, because red meat could be fatty, have those bad nutrients, right? So also in terms of carbohydrates, so it should be at least 20%, 25%, where you see the big corner, big chunk of could be whole grains and also bread, brown bread. So, and don't forget to make water your drink of choice. So this should be a healthy plate every meal that you should have every day. So there are not actually no magical ingredients or nutrients for a person to protect a person from developing dementia. However, if you ask me what kind of diet could be recommended, according to research, the studies are looking different type of healthy diets, and Mediterranean diets seem to be Mediterranean diet should be according to research is the best one for preventing dementia and Alzheimer's disease. And the Mediterranean diet is high in omega-3, fish, vegetables, and olive oil, right? And also some studies are looking to different healthy diets, like the DASH diet, for example, which is a dietary approach to stop hypertension. So it's low in salt as well, salty and different type of food. So there are many approaches. You'll see a lot of information, but eating healthy, just follow the Canada's Food Guide could be a simple step to start preventing Alzheimer's disease and dementia. So eat healthy will be our number 3 recommendation. So number 4, be social, believe it or not. It's so important for our brain. Our brain is such a social organ, I would say. And also we need to connect with others. Our brain needs connections. So join a club, walk in groups or choir, catch up with family and friends, call neighbors. You can either, if you're retired, you can also volunteer in your community and do things that could be beneficial for your brain and also help you to stay connected and develop those connections for your brain. So number 4, be social. And there's also a lot of evidence that we can see that our brain needs those connections. And actually there's a big research that was done in Spain about social lifestyle and also white matter, which is areas of the brain that are involved in cognition. So it's so important that this study show that there's some changes in the brain while we are connected. So just to also to mention that we know we're living, or we have lived a few months of for some people could be difficult to socialize, and I encourage everyone to join your local community centers or your local activities in the community, or even connect with the Dementia Society. We have lots of things so it can help you to be connected and, break isolation and different activities that you can do. So number 4, be social. Number 5, challenge your brain. And we are, always encouraging people to challenge your brain and expose yourself to different things, expose your brain to new things, and do more than one type of activity. Mental activity also help people to, increase your cognitive reserves, and also using these activities can help also to challenge every day and maintain your memory, thinking, attention, reasoning abilities. There's not a specific activity that I would recommend. I think also it's something that you enjoy. I know people talk about crosswords, puzzles, Sudoku, but even things like brain teasers, or, reading a book, or learning a new language could be something that or even learn how to dance or do something fun, right? Could be beneficial to challenge your brain every day. So it's important to challenge your brain and stay connected and active. And we do at the Dementia Society have the Brainy Active Challenge every year. So we encouraging people to stay connected, challenge your brain, and be brain healthy as well. So this happens every year. So number 5, challenge your brain. Number 6, protect your head. And these days we know more that actually there's a relationship between head traumas and Alzheimer's disease and other type of neurological conditions related also to concussions. So head injuries place the brain at risk for how it works, and also could be a risk factor for dementia. So we can start simply as wearing a helmet in sporting activities, very important, and also wear a seatbelt when you're in a car, and things like reducing the risk of falls, right? So use a mobility device if you need so. Also wear the proper shoes, make sure the surfaces, and you can avoid falls as well, especially during the icy seasons, right? So make sure you protect yourself from falls. So this is something not only important for the brain, but also for the full body. So we encourage everyone to, make sure they have, safety first, right? For your head. And number 6, protect your head. Number 7, sleep well. And I know for some people could be a bit challenging, but sleeping well is so beneficial for the brain. So the brain, while we sleep, it seems that our brain gets washed out from those toxins and waste that produce Alzheimer's disease, and also helps to consolidate memories. So we need to get at least 7 to 8 hours of sleep every 24 hours period. There's some also recommendations about having a regular sleep routine, try relaxation techniques. If you do regular exercise, your sleep pattern will definitely improve, and expose yourself to light during the day. Last year, I was reading about an article that talks about the use of different screens and the lack of sleep. And it seems that it's also beneficial to turn off your cell phone, your screens in your room while you sleep, so that way you can have a better sleep. So it's important to improve the quality of sleep. And if you do have a sleep problem or a sleep concern, you can also talk to your doctor so they can take some actions to help you improve your sleep. So number 7, sleep well, very important for the brain. Number 8, and this is the last one, but as I mentioned, not the least important. And I know, or we know, that caring for mental health is so important these days. In January, actually, Blue Monday, right? So we're trying to improve our mental health, to stay connected, to build resilience, talk about your mental health. And also, if we practice all the brain healthy choices that I just mentioned, I'm pretty sure your mental health will improve, because brain health and mental health is highly interconnected. And it's important also to stay positive, to have a positive mental health and build resilience. I highly recommend you to watch or join us next week. I will give you the details in a bit, but I highly recommend you to join us for stress and depression as a risk factor for dementia next week as a webinar by some speaker from the Royal Hospital. So also just to mention briefly that according to the City of Ottawa Public Health, some steps to help us to improve our mental health, especially during these days, try to unplug from media sometimes. Physical distancing does not mean being alone. You're not alone, and it's okay not to be okay. It's not easy. And take care of your body and stay active during these days. So that way you can improve your mental health. You can take care of your mental health. And there's also a lot of mindfulness videos posted on our YouTube channel, so you can use while you're like stressed out, or if you want to listen to those mindfulness videos that also can help and support you during difficult times. So number 8, care for your mental health. So now we actually talk about our 8 brain healthy choices. So what can I do now, right? Brain healthy choices make a difference, right? So let's kind of recap. So number 1, care for your heart. What is good for the heart is good for the brain. Number 2, be active, right? Very important. 30 minutes at least every day. Move more and sit less. Number 3, eat healthy, right? Vegetables and fruits. Number 4, be social. Join any club, have friends. Stay connected. Number 5, challenge your brain. Do something fun that is different for your brain, right? Every day. Number 6, protect your head. Wear a helmet. Number 7, sleep well, 7 to 8 hours at least. And number 8, take care for your mental health. So those are the brain healthy choices. They are ways to prevent Alzheimer's disease and dementia. So they definitely make a difference. So you can start right now. There's not a specific age or a time that you can start. You can start anytime. So as I mentioned, 8 ways to be brain healthy handout. I have sent them through the email I sent earlier. So you have a copy of this, so you can put it on the fridge or your room. Or, if you're just starting your New Year's resolution with, a brain healthy resolution, so you can start following them right now, starting from January 2023. So talking about that, where do I start now? Well, you can set up an action plan. So pick a healthy choice to work on. So step 2, make a goal, make a plan. And also be realistic and specific. I know everybody is very busy. Sometimes it's not enough time, but try to be realistic about your time. And you can start small. Every step, every small step makes a big impact. So definitely you can start right now. So those are the brain healthy choices. And those are, as I mentioned, ways to prevent Alzheimer's and dementia. So now we're going to move into another topic. So it's our aging brain, right? So we know that as the brain ages, like the rest of the body, there's some changes. We know that we experience some changes, but we have some positive things, like, for example, life experience, wisdom. We can learn new things and adapt to new things at any age. And we know that some changes are in memory, for example, concentration, and our thinking and the speed is not the same, right? But we have a system to sort of like cope with these changes, right? We have more, for example, we take more notes, we write down things on our booklet or diary, or, any reminder that we have, we can just write down or take notes. So we have a system to improve those. So that's something. Aging it's a normal process. So I'm going to be also talking about a little bit about dementia. So what is dementia? I'm pretty sure you heard about dementia. So today I'll be telling you that dementia, if I have to define it, is it's a group of symptoms that are a consequence, a result of different brain conditions, right? So if I have to define it as I also would say dementia is as an umbrella, right? So dementia is an umbrella term. And under the umbrella, we have different type of dementia or brain diseases, right? So we see Alzheimer's disease here at the bottom. Uh, Alzheimer's disease is the one that we're talking this month, right? It's the Alzheimer's Awareness Month, and we're talking about Alzheimer's disease as a brain disease that affects the brain through the accumulation of plaques and tangles. So those are waste in our brain that accumulates abnormally, and those could affect the neurons or the brain cells. So the person with Alzheimer's disease could be affected, right? So those are symptoms, and as a result, will develop dementia. But Alzheimer's disease is not the only type of dementia. So that's why we, the Dementia Society, actually, our name is very inclusive through different dementia. So we also talk about other type of dementia, for example, vascular dementia. I'm pretty sure you heard about vascular dementia. It's related to stroke. So it's more related to blood vessels. And also it's another type of dementia that might cause, the vascular dementia could cause symptoms, right? So in addition, we have dementia with Lewy body, which is not very common, but also we see some persons living with Lewy body dementia. Frontotemporal dementia, Parkinson's disease dementia, which is also related to dementia, to Parkinson's disease, and mixed dementia, which overall it's is a combination of different type of dementia that actually is a big proportion as well. So I have to say that also dementia, everybody is different. So every person is unique. So we say that dementia is no one size fits all. The symptoms can differ. And it's like a chronic disease. That means it takes years to develop. It's not something that will develop or we evolve in a couple of days. It's something that dementia takes a while to develop. So dementia, as I said, is a result, it's a consequence, it's an umbrella term, a result of different brain conditions or diseases, such as Alzheimer's disease, okay? So this is an easy way to understand dementia as a condition, right? So the symptoms that happen or occur in dementia will be a bit different in everyone, but however, we know that dementia can affect memory, thinking, judgment, learning, speaking and listening, orientation, and understanding. So, as a result, dementia, a person loses their ability to be independent and also manage their daily activities. So that's actually the definition of dementia. Okay, so, but I have a good news for you, because dementia is not normal aging. So as I mentioned, dementia is a consequence of different brain diseases, brain conditions, and it's not normal aging. So it's very important that we can differentiate both situations, right? And in that note, we have the 10 warning signs of dementia. So this, you also have a copy of this one. So the 10 warning signs is to show you that there are different signs that a person with dementia could experience. For example, we always talk about memory loss. I know it's quite known, right? We kind of relate dementia or Alzheimer's disease with memory loss, but it's not only about memory loss. There are other symptoms, for example, loss of initiative. For example, a person really enjoys some activities and all of a sudden this person is not motivated enough. So it loses the initiative for this activity, for example. But things like challenges with performing familiar tasks, right? The person enjoys to cook something and the person knows a favorite recipe, and then all of a sudden forgets about the task and the steps to do it, right? And things like changes in mood and behavior, misplacing items, changes in judgment, changes in personality. So also I have to explain that these 10 warning signs are not the 10 warning signs that a person needs to be diagnosed with dementia. So it's just to make sort of like aware, create some awareness about the different signs. But a person with dementia could experience any of them or all of them as well, right? And it's not also exclusive for dementia, because there's also other conditions that could mimic, right? For example, if someone is depressed, could experience any of these symptoms as well, right? It could have memory loss, it could have loss of initiative, it could have changes in mood. So, but it's important to rule out dementia, right? So is there any concern or question about those symptoms? The first step definitely is to start with your doctor. So talk to your doctor about any changes in thinking, memory, or behavior. So if you're worried about or someone you love, you're worried for someone, or you want just to ask or have some questions, you can always talk to your doctor about those changes. And also, if you have more concerns, or if you want concerns about these changes in thinking, memory, behavior, or if you want to learn more about dementia, or even you want to, keep learning about brain health, why not, right? So keep learning about how it can prevent dementia. You can reach out to the Dementia Society. We're here to help. So this is our website, dementiahelp.ca, our phone number, and our email address. So you can actually, take advantage of the good resources that we have to inform you about dementia. And it's all free for you. It's research based, and also we have a whole team that works every day to make people with dementia lives easier in Ottawa and Renfrew County. So you can reach out to the Dementia Society. We're here to help. So also, in addition, as I mentioned previously, we are very lucky to have our next webinar for Women's Brain Health Initiative. So we are going to talk next week, next Wednesday, January the 18th at 5 p.m. We're going to talk about stress and depression as risk factor for dementia. So I highly encourage you to, to participate, to bring your questions, to join us and be part of this movement. We're promoting a lot of brain health initiative this year, and I'm so happy that this is really happening. And so their speakers are from the Royal Mental Hospital, and they're experts in the field. And yes, so I will be following up with an email. So you're going to have the registration link. And also I share a handout, sort of like to tell you a little bit about the event. So I highly encourage you to follow next week and join us next Wednesday. But in the week number 4 for the Alzheimer's Awareness Month, we're not done yet. So we have more. So we're going to have a live Q&A session with local dementia experts. So you can talk about dementia and wellness. So we have a panel of different experts, including Dr. Andrew Frank. He's a neurologist from the Rier. But also we have some people from the Dementia Society, a dementia coach, a dementia care coach, and also we'll have a spiritual leader as well for those topics regarding spirituality. So I highly recommend to join this live Q&A, and you have the opportunity also to send us the questions. So if you go to the website of this, also we'll share the link. So if you go to this website, you're going to find a place where you can actually send your questions to the speakers, so the speakers can reply to you directly. So that's on Tuesday, January 31st. So it's the last day of the month, and it's at 5 p.m. It's on Zoom. So with that, also, I have to, do a little summary of sort of my takeaways today. So brain healthy choices make a difference, make a plan. So this is so important if we want to prevent Alzheimer's disease, and we need to follow the brain healthy choices. Have a brain healthy lifestyle could definitely make an impact. So the brain ages as the rest of the body. So we need to take care of our brain, reflect about your brain, about what things you do to make your brain healthy and how important our brain is. Dementia is not a normal part of aging. So this is very important. Dementia is a condition where there's symptoms as a result, as a consequence of different brain diseases, right? Or brain conditions. So, and if you have any concern in changes, memory, thinking, or behavior, you can talk to your doctor. That's the first point of contact. But you can also connect with the Dementia Society if you want to learn more. And so lastly, I just want to also remind you that the brain healthy choices: care for your heart. What is good for the heart is good for the brain. Be physically active. Okay. Number 3, eat healthy, be social, challenge your brain, protect your head, sleep well, and take for your mental health. And in addition, if you want to keep learning about our services or our programs or education, or how we can make an impact and how we can help and support in our community, people living with dementia and their caregivers, you can subscribe. You can go to our dementiahelp.ca website and subscribe to our weekly roundup. Also, there's also an opportunity to, subscribe and keep up to date, and as well as, be updated and informed about different type of activities and research. And so weekly roundup is such a good way of communicating with the community. So with that, we got to the end of this presentation, and has been a great pleasure to be your speaker today. I hope you learned something new, and I hope you start taking care of your brain health since day one, since January, as a brain health resolution, and also becoming brain healthy to prevent Alzheimer's disease and other type of dementia.